Hey guys, today we're going to be talking about the assessment of the hematological system. And the book misrepresents, the syllabus said that it was chapter 32. As you can see, it's chapter 39, but the pages were correct. So you're responsible for the PowerPoint and then the pages that were listed in the for chapter 39, but you are responsible for what is on the PowerPoint as well. I don't really think there's anything that extra on there. I'm just letting you know that you're responsible for the PowerPoint and the readings that are there. All right, so starting with Chapter 39, Assessment of the Hematological System. So the concepts we'll be talking about is the priority concepts for this chapter are clotting, which is a complex multi-step process by which blood forms a protein-based structure called a clot. The clotting cascade is very complicated and not something that we're going into in this course. I believe that was covered in pathophysiology. I still have nightmares about it, so we're definitely not going into the clotting cascade today. Perfusion is the total arterial blood flow through the tissues. And when it goes through the tissues, that's peripheral perfusion. And the blood that is pumped by the heart is central perfusion. Okay, so we're going to be talking about clotting factors and we're going to be talking about perfusion. So those are the two things we're going to talk about in today's lecture. So a brief A&P review. Remember, our bone marrow is responsible for blood formation by producing both RBCs, white blood cells, and our platelets. Now, what are the blood components? And this is very important to know because when you start working in the hospital or wherever you are, and they start talking about giving different blood products, it's important to know the reasonings on why our patients would be giving these different types of product. So, plasma is extracellular fluid between the other blood components. There are three types. Albumin maintains the osmotic pressure of blood, which prevents the plasma from leaking into the tissue. That's the reason when people are what they call third spacing, or they've got or they have what they call anasarca. You'll learn about that in 495, I'm sure. It's where they just have this gross amount of edema all over their body. They usually have that extracellular fluid leaking into out of the cell. So with that being said, the job of albumin is to prevent that plasma from leaking into the tissue. So a lot of times these patients will get albumin comes in little ampules. I think they're 100 cc's. I could be wrong there. And they're given very quickly. And so that's one of the reasons that someone would get albumin is if they're to prevent that the extracellular from leaking out. Okay, globulins. The second part of the plasma proteins are globulins. Globulins help transport as antibodies to protect the body against infection. The third component of the plasma proteins is fibrinogen. Fibrinogen is the activated form of fibrin, which helps with clotting. Now, red blood cells or erythrocytes, now there are different ages and things, but for our purposes, we're just going to lump them all together. The red blood cells or erythrocytes are the largest portion of the blood. RBCs produce hemoglobin, which needs iron to transport oxygen. Hemoglobin carries carbon dioxide to help with the acid-base balance as well. Now, white blood cells are reviewed in Table 39-1. Our white blood cells, or leukocytes, are reviewed in Table 39-1. For our intents purposes, I just want you to know that different leukocytes do different things. And the three things that white blood cells do is they work with inflammation, they are antibody-mediated immunity, and cell-mediated immunity. And all of those are different portions of our white blood cells. Now, platelets stick to injured blood vessel walls, to stop the blood at that injury site. So that's what platelets do. Platelets stick to the injured blood vessel walls to stop the blood at the injury site. So that's the reason that patients sometimes will get platelets. If they're getting packed red blood cells that have had the other parts of the blood removed, sometimes they're not just losing red blood cells, they're losing all the other blood products as well, including our platelets. So when we're administering platelets, we can give those fairly fast. And a lot of times, if someone is having a hemorrhage, they'll give they'll give platelets, because remember, when they're hemorrhaging, they're not just losing the red blood cells that we're replacing; they're losing all the different blood components, and so that will help if they're given platelets to help with the clotting factor. The spleen helps with blood cell production. And remember that our liver helps with clotting factors. Now, for those of you who are panicking, saying, oh my goodness, she said so much, and it's only a few things on the slide, please remember that I have put everything in the presenter's, remember that I put everything in the presenter's notes, and I have opened that up to you. So all you have to do is open the slide up to the presenter's notes, and you get basically everything I said except for my, funny little comments. All right, hemostasis and blood clotting. Remember that blood clotting is part of a multi-step process called the clotting cascade. That's all you need to know about that. And just know that different clotting factors, when they're removed out, do different things to that clotting. Platelet aggregation starts with the platelet plug triggering the clotting cascade, okay? That's blood clotting. Intrinsic factors versus extrinsic factors, and the fibrinogen clot formation. I feel like I wrote something about that. This is a picture of the anti-clotting forces. For our testing purposes, just remember that fibrinogen makes the clot. If you have fibrinolysis, the clot is broken down. Okay, and so that's really from this slide all you need to know. Again, this is a review, not what we're here to study today. Going on to something we are here to study today is looking at the hematological changes associated with aging. You know how I love these. Big things we need to know about our patients that are aging, that they have a decrease in their blood volume with lower levels of plasma proteins. With these aging changes in the blood products, you also see the lower plasma protein level may be related to lower dietary levels of proteins and reduced protein production by the older liver. Bone marrow, as it ages, it produces fewer blood cells. The total number of red blood cells and white blood cells are lower among older adults. Lymphocytes become less reactive to antigens and lose a lot of their immune function. With that being said, antibody levels and responses are lower and slower in older adults. And their white blood cells, their count is lower, which of course makes them more immunocompromised. Hemoglobin levels fall in both men and women, but more so in women, with iron deficient diets may play a major role in this. Now moving on to our assessment findings associated with aging. Please review chart 39-1 if you have the written book. That's on page 800. You're going to see that their nail beds, remember for capillary refill, you'll see that they are thickened or maybe discolored. Other things is hair distribution. Progressive loss of body hair is a normal facet of aging. Skin moisture, their skin is a lot drier. And skin color, a lot of times it will lose their pigment, and skin yellowing is common signs associated with aging as well. The skin color changes, especially from pallor and jaundice, are associated with some liver disorders as well. So these are the hematological assessment findings of the older adult. Just remember, they've got the thicker nails, they have less hair, their skin's dry, the color's not as good as it used to be. It's kind of a pale yellowy color, kind of a lot more pallor. Makes you want to look forward to get big growing up, doesn't it? All right. Okay, the next part, I'm not going to read it all to you. We're going to look at the assessment. Remember, you're going to do your regular history. You're going to look at our liver functions. You're going to want to look at what drugs they use, their dietary patterns, their socioeconomic status. Are they pica eaters? Are they iron deficient and they eat the pica? Some people eat toilet paper. Cornstarch is popular a lot of times when people have iron deficiencies as well. I always thought that was just something I learned in nursing books, but it really is. There's people who eat things that are quite odd. You see it a lot with pregnancy. Patients also, you have to look at their occupation and their hobbies. And the location of their home also can make a difference in their hematological status. I am not going to go in, even though I mentioned the table. Just know that there are drugs that impair the blood, the blood system. Okay, good. We already talked about making sure that we look at their nutritional status, family history, and any current health problems that they may have. I do want you to review pages 802 to 803 because it does look at the physical assessment findings that you'll see with the hematological patient. One of the big things on this is the action alert on page 803. It talks about if someone has had a hematological problem or a trauma, you do not palpate the spleen area because it can actually cause more of a hemorrhage. So we want to make sure we don't do that as well. But do look at those physical assessment findings and how they differ from the norm. All right, I'm going to stop us here and we're going to come back with the diagnostic assessment.